Afternoon, everybody. My name is Leslie Ann Johnson. Welcome to this afternoon's post-cabinet press briefing. A little change in the time for today. And we have with us today the Honorable Minister for Health and Social Security, Nickolas Steele. He will be giving us an update on COVID-19. We also have with us Ms. Forrester, the Attorney General, so she will discuss changes to the regulations. Without any further ado, I'll hand you over to the Honorable Minister.
Thank you, Leslie Ann, and good afternoon to you all of our viewers and listeners, members of the media out there. Thank you for accommodating us at this later hour. It was to ensure that both myself and the AG could be present to give you briefings. I'm going to go right into our briefing for COVID-19 with respect to cases. We do have one more case to announce today. Results came back late last night, and one individual, travel-related individual, is in quarantine and has minor symptoms of a headache and cough. Person traveled in from the US. Will be kept in quarantine like all individuals until the person has been medically cleared. This brings our total number of active cases at present to 12. Of those 12 active cases, 10 are travel-related individuals who were picked up as being positive after arrival and while still in quarantine. The other 2 individuals are related to our December cluster who still remain positive, but we hope and expect them to clear within the next 24 to 48 hour period based on the length of time that they have been in isolation and also pending an additional COVID-19 PCR test on them. Our total total positive cases to date are 139 at present. And let me repeat, 12 active cases at present. Of those 12 cases, 10 are travel related, 2 related to our December cluster. One new case to announce today, bringing that total that I just announced. Having said that, I think we do want to spend some time talking about the new regulations as we move forward. So I will pass you back to our host and look forward to hearing from the AG and answering any other questions you may have.
All right, thank you, Honorable Minister. So we hand you over now to the Attorney General, Ms. Forrester. Good afternoon.
Okay. Good afternoon, everyone. Just to update you in relation to the new regulations and proclamation. So what we have now present is the Emergency Powers COVID-19 Proclamation 2021, and that's SRO number 2 of 2021. And likewise, the Emergency Powers COVID-19 Regulations 2020, which is SRO number 3 itself. So in total, these are the main things that we wish to raise based on what has been done. Firstly, and I know there's a general concern in relation to whether or not there has been a declaration of emergency, because the last declaration of emergency was done on the 21st day of December 2020. Now, of course, in the normal scheme of things, a declaration of emergency, that proclamation that accompanies it lasts for 21 days, and that would have lapsed today's date. So what would have been done is that initial declaration of emergency was actually revoked, and a new declaration was done by the Governor General. So that was done yesterday on the 11th of January 2021, and of course it was properly gazetted, and all necessary steps that had to be taken for it to come into effect were in fact undertaken. Moreover, that state of emergency, that proclamation, is going to last for 21 days, so it runs until the 2nd of February 2021, and that will apply unless the Houses of Parliament fail to pass a resolution during that period, either to adopt the proclamation that has been made by the Governor General. So, as persons may be aware, there is going to be a parliamentary sitting on Friday, and at that stage, the Houses, at least the House of Parliament, will take necessary steps, and then the Senate would follow thereafter when the Senate sits, if those things are actually passed by resolution. In terms of the regulations itself, The main things in the regulations that have changed in comparison to what was present in the last set of regulations is the curfew period. The curfew period has been changed from 8 p.m. It now goes from 10 p.m. instead to 5 a.m. So previously our curfew period was 8 p.m. to 5 a.m. So now we are 10 p.m. to 5 a.m. daily. In terms of other significant changes within the regulations, we have for funerals and weddings and private gatherings. Okay, for funerals, weddings, and private gatherings, they are now up to 20 persons. And if you need to have anything beyond that number, then it's merely a matter of applying to the Chief Medical Officer and the Commissioner of Police for permission to get that additional permission for the extra numbers that you need itself. So other than those two things, the regulations are substantially, not substantially, they are indeed the same as was existing before. So I am not minded to go through what was already there because persons are generally aware and familiar with them in full.
Thank you very much. Colleagues, so we are keeping it fairly short today. So we've heard from the Honorable Minister and the Attorney General, Ms. Forrester. Are you ready with your questions?
Questions?
Go ahead, Linda.
Right. My first question is to the Health Minister from the cluster. Today is the 12th of January. The cluster actually started around the 11th, 12th of December, so it's almost about a month. Is there medical challenges or some medical development with these two persons who from the cluster who is still in quarantine? Because most of the persons seems to have been cleared medically. So what is the reason that they're still there after a month? And to Ms. Forrester, I went back and looked at the other proclamations and I realized they all had dates. The proclamation issued yesterday, I see no date of start and end. Can you explain why it is written that way?
Linda, thank you for your question. And no, we are consistent as we have been in the past. There is to clear from COVID-19, there are two ways. One is negative PCR. In fact, it's supposed to be 2 negative PCR in a 24 or 48 hour period, or as WHO PAHO recommends, is passing. What we have done is relied on both. So in this instance, those individuals would have passed their 14-day since their first positive result, but we are still, out of an abundance of caution, waiting for negative PCR results from them before we clear them. Out of an abundance of caution, we are doing that, and it is the same policy we've had for individuals who test positive in quarantine or individuals who test positive from transmission from someone here in Grenada.
Okay, Linda, to answer your question in relation to the proclamation having a start and end date. Now, the proclamation actually has never had a start and end date. The proclamation lapses after 21 days. I think you want to ask if the curfew has a start and end date. So the curfew would have started on the 11th, of course, of January, and the curfew would lapse the same time as the proclamation would lapse. So the same way how the proclamation lasts 21 days, the curfew would likewise last for that period of time. But it is important for me to state that the regulations are under consistent review. So the curfew period, or even having the curfew, may change at any time. It may be shortened, it may be extended, or it may be removed altogether. Those decisions are really informed by what are the current state of affairs and if there is actually a need to have it based on the medical advice that is being received and the instructions that are given to, of course, our office in terms of what has to be in place or what has to be changed.
Thank you. GBN, good afternoon. You have another question, Linda?
I had a follow-up, please.
Okay.
And the follow-up had to do with to Minister Steele. Thank you, Ms. Forrester. Minister Steele, can you tell us if we will have a new we're having revised travel protocols. And if Sanders did announce that, I think sometime in February they will be resuming accepting new guests. Can you tell us if there are any changes to that? That is going to be earlier or it is still into February?
Linda, with respect to travel protocols, we have taken into consideration the most recent release from the Center for Disease Control, which was in December, which says the CDC recommends that individuals get a pre-travel test between 1 and 3 days before travel, that individuals get a post-travel test between 3 and 5 days after travel, and that individuals remain in isolation for 7 days after travel. Now, what we have had up to yesterday was that individuals had to get, as CDC said in December, a pre-travel test of 1 to 3 days, 72 hours. We were testing individuals on day 4. The CDC announced and revised in December that persons should be tested between day 3 and day 5. So we have made a decision that we will test on day 5. We would go to the extremity of the CDC recommendation, and that the CDC now recommends that individuals remain in isolation after travel for 7 days. We previously had it persons being released between day 5 and day 6. We will now move to persons remaining in quarantine isolation at a state-approved facility for 7 days. So they will be tested on day 5, and regardless of whether they receive their negative test results before the 7th day, they will be requested to remain in quarantine until the 7th day after traveling into Grenada. So that is the adjustment that we are making on the revised recommendations from the CDC as of December. Also, with respect to travel or travel related, we have continued the direct commercial flight restrictions from the United Kingdom. So there is a restriction on direct commercial flights from the United Kingdom, and that goes until the end of January. However, individuals with a travel history from the United Kingdom can still come to Grenada from a third-party country once they meet the criteria of the 72-hour negative PCR test before arrival in Grenada, and also will have to go through the quarantine as I just described it.
That's it for now, Linda.
Clarity. So people will now be tested on day 5, but is expected to remain in quarantine for at least 7 days.
That is correct. Yes, that is correct.
All right. So it is not 5 plus 7, 12. It's
No,
7 days.
7 days.
All right. The other thing I saw out of Barbados recently that persons who would have gone beyond the 7 days, that the state is taking up the funding for remaining in the quarantine. Is that under consideration for Grenada? Because recently we would have had some people, there was one person said that I know personally up to 10 days, which came at an extra cost to them. Is that under consideration for Grenada?
Linda, I can't speak to Barbados, but I know we have told people to make a reservation for a minimum of 7 days, and that the quarantine period is actually 14. And that if medically cleared before that, they would be, and that we would test on day 4, and once they had a negative test result, and we received that negative test result, we would clear them. Over the December period, as Barbados is experiencing now, we found ourselves inundated with the number of tests we had to do related to the December cluster, as well as individuals traveling in, which, as for almost every country in the world, December over the Christmas New Year's period is one of the highest travel periods as well. So we had a sort of a double load on us, and we were delayed with releasing individuals, but we made sure up front that individuals are told they are to book for a minimum of 7, and that the quarantine period actually is 14, and that we would endeavor to release them. As we are now saying, they'll be released on day 7 once they have a negative test, and we have those results. If there are delays because of demands within the community of us getting those negative test results back, we would not be able to release people on day 7, and we would have to rely on the other form of quarantine mandate, which is, with or without a test, 14 days quarantine.
All right, GBN, good afternoon. GBN, are you hearing us? Go ahead.
Yes.
Go ahead.
Jared Joseph, GBN News. Minister, what is the rationale for the state of emergency and the curfew? That's my first question. And also, businesses that mainly operate at night time are most affected by this curfew. Will stimulus packages or support mechanisms be available for such entities and their workers? Citing that, these businesses would have been closed since, or some of them might have been closed since before Christmas, and would remain closed until just before independence. Will support or stimulus packages be provided for them, and would those stimulus packages include people within the entertainment industry? These people have been hit, adversely affected by the pandemic, the lockdown, the whole situation for 2020, and it's now come into 2021. So these people, musicians, artists, singers, there was no carnival, no Christmas. That means thousands, maybe thousands of dollars lost in revenue for these people and their livelihoods. Would some sort of support be given to such persons?
Okay, thank you for your question. With respect to the state of emergency and the curfew, one facilitates the other. So the state of emergency is there to facilitate the curfew. Now, the reality of the situation is that this week, today, compared to last week or last month or any time last year, the threat of COVID-19 is even greater than ever before. The death rates in other countries are even higher than ever before. Our neighboring countries like St. Vincent, like Barbados, are all going through the challenges. And what is recognized, and we are not alone in this and in our response to COVID-19, that what you have to do is to minimize activity as much as possible without strangling your economy completely, which is why we have said from the beginning that we cannot remain closed indefinitely. And it's not just the entertainers that are being affected at all. There are many, many others, and the government is very much aware that there are many other individuals. In the hotel sector as well, we have closure of hotels still. Some closed in December. Some have most recently been contemplating announcing closures. And we have some that haven't opened up since the initial closing of our borders in March. So there are many individuals that are affected, and we do identify with as much as possible, which is why at this point, at this week, when we saw the threat has not been removed, while I'm saying the threat is even greater, but the local epidemiological situation has improved with respect to that December cluster. So we have given an easement on the curfew. Instead of from 8 o'clock, the curfew moves to 10 p.m. Now, from a medical standpoint or epidemiologists, they will say that we shouldn't have any activities at all. We should all still remain at home, because anytime we go out, there is a risk of spreading or catching COVID-19. But we cannot exist like that. So we have to find that balance. This week, based on Grenada's epidemiological situation, the best balance we can find is to move that curfew to 10 p.m. to give some form of opportunity for those who are involved in the hospitality business, who are involved in the entertainment business, who are involved in bars and restaurants, etc. And for the rest of us, general public, even supermarkets, groceries, shopping, us to have time out and outside, outdoors as well. that can be extended to 10 p.m. It means that individuals who work from 8 to 4 don't have as much of a rush to get home as they would have if the curfew was at 8 p.m. So there's constant adjustment, and the adjustments are because of the local situation at any one time. If we were to have another cluster outbreak, then we would have to reconsider those hours. If we continue the way we are going and we see an extreme level of compliance, then I do hope and I look forward to us being able to consider another form of easement or so that would give more individuals an opportunity to get as close as possible to a life of normalcy or pre-COVID normalcy, and that's economic as well as social. But at this point in time, it is not possible to go further. We are very much aware that there are 2, possibly 3 new strains of COVID-19. And in each of those cases, they're extremely more contagious. The strain out of the UK, by all information that we've received, is 70% more contagious, which means that any of the breaches that we would have had before, where Grenadians were put at risk from somebody who was COVID-19 positive, the chance of other Grenadians being infected is almost 3 times higher. So almost 3 times more Grenadians would have been infected. So in other words, if it was one of these strains that affected us in December, and that's still undetermined, 3 times as many Grenadians would have been affected by it. That's basically what it means when I'm saying that the threat increases while the local epidemiological situation may be under control. The threat increases, and therefore, regrettably for us, we do have to continue with certain constraints.
That's it for you now, Gerard, for the time? All right, so let's move on to...
Thank you.
Yeah, okay, great. Nancy Maguire, good afternoon.
Good afternoon.
Go ahead.
I have a question following up from last week when we spoke about the process for vaccinating Grenadians. You said that you were stepping things up and you had further information. So I'm just wondering about that, whether it involves private sector institutions, community clinics, or whatever. And do we have the ability to test for these new, more contagious strains in Grenada? And 3, a question from a colleague about the gentleman in the Limes that was suffering from hoarding and what the situation is with him and the location and how you're handling it as the minister and the MP. Thank you very much.
Thank you, Nancy. On the vaccine update, there is still not a vaccine on the way in terms of to be delivered to any of our CARICOM countries. I have, as recently as today, had discussions with counterpart ministers. The only WHO vaccine still approved is the Pfizer-BioNTech vaccine, which needs to be transported and stored at -80 degrees. We do have now confirmed ability to store said vaccine here in Grenada, as opposed to last week. We are able to store that vaccine, should that be the vaccine that as a CARICOM or as an individual country or as OECS we decide to go with. We are also in communication with Moderna, which is another vaccine that has received approval in the US, and also with AstraZeneca, which is a vaccine that has received approval in the UK and other European countries with respect to Pfizer, Moderna, and AstraZeneca. Those are the only 3 at this point in time, because those are the only 3 that have either received approval from WHO or are well on the way in the process of, so that it is safe and prudent for us to have discussions with these manufacturers, so that if and when there is that WHO PAHO approval, we are ready there to pull the order out and have it shipped once it is approved. There are still a significant amount of discussions to be had public discourse on vaccinations. I know that there are many people who have a certain level of anxiety with respect to this particular vaccine, which would have been many other people. Most of them would not have had or don't have that level of anxiety or so for all of the other vaccines, polio vaccine, rubella vaccine, mumps vaccine, all of the others that are implemented as part of our national policy here in Grenada. Even individuals who annually would take the flu vaccine or who would take hepatitis vaccine, etc. So we recognize that, and we know that this discussion has to be had, and we have started having that discussion in small circles, but a public discussion has to be had. I think what is lacking right now is more information on those vaccines that are possible sources or cures for the COVID-19, and the ministry will be providing additional information. Right now, what is out there on social media is a lot of negative and misinformation with respect to vaccines and vaccine with microchips and all sorts of things. There is a valid need to be concerned and to take the safest route possible with respect to any medication, and which is why Grenada has said from day one that we would not be using a vaccine unless it is approved by WHO and Pan American Health Organization. We have still not changed that. What we have recognized is that there are many national bodies, for instance the CDC, Public Health Canada, NHS of UK, and European Centre for Disease Control, who are equally capable or a significant part of the WHO approval process. So when we see them approving certain vaccines, we begin the discussion and seeking more information on those vaccines, because we believe it is well on the way to approval. But at this point in time, there isn't a vaccine on the way for us. There is still need for discussion. That I will recognize from individuals that there are concerns, because this is something new, and anything new there is concern. I will publicly say that once the WHO has approved a vaccine, I would take that vaccine. I would, like the rest of you, have concerns about taking a vaccine that is not approved by WHO PAHO and hasn't gone through that process. But I hold hard and fast to the same principles I would have had before COVID-19, that vaccinations have cured many of the deadly diseases that would have plagued us. Vaccinations continue to cure many of the deadly diseases that plague us, and that once a vaccine goes through the proper procedures for approval, then it is safe in my mind and in the mind of most health authorities to be used. An update on the let me get your other questions. With respect to the contagious strain or any of the contagious strains, the only facility within CARICOM that I'm aware of that can test for the various strains is CARFA. CARFA has informed us that should any of us have the desire, need, or concern to find out if any of our positive cases are any of those strains that we are concerned about, to send samples to them the same way we send samples almost weekly just to verify our testing process as well. We would. What they have asked, though, so that they do not get inundated, because it's a much more lengthy process to actually identify the strain as opposed to simply say COVID-19 positive or not. They have asked us not to send samples for the time being unless the individual has a travel history or has come directly from the UK, and simply not categorically saying from that or implying from that this strain doesn't exist other places, but that right now the facts are that 70 to 80% of the positive cases in the UK are this new strain, and therefore that is why they have made that criteria. The individual in the Limes who was needing of help to clean up, today I was personally there to see for myself that the house is completely cleared. The property is completely cleared. I want to thank all of those who volunteered to assist. Truckers and other individuals, those in my constituency office as well, who came out to assist this individual in need, to clear up the neighborhood that he was in. And the individual, what we are now looking at, working with social development and others in the community, is to see how we can make this individual as comfortable as possible in his new clean surroundings of his house, so that just from a humanitarian standpoint, that we are and continue to be our neighbors' keepers. But I can confirm that the property has been cleared up.
Thank you, Minister. Thank you, Nancy. Callistra, good afternoon. Callistra, are you there?
Yes, I'm here. Can the Minister of Health give me an update if there's any new information on the the committee, that was put in place to investigate our first COVID-19 related death? And could the Minister also speak on the conditions at the laboratory for the technicians and the workers who work there? During the cluster situation, for instance, they had to work a lot of extra hours, work through the holidays, work nights, I'm guessing. And it seems as if there are no proper humane facilities for them to rest when necessary. So could the Minister speak on whether or not any plans are in place to improve the conditions at the lab for the technicians? And the Attorney General, can you explain to me where in Section 17, if there's anything in Section 17 that gives the Cabinet any authority to make laws and regulations? And or can you let me know whether or not those proclamations, the start and ending of them, were gazetted?
Okay, Callistra, thank you. With respect to the committee update, and yes, I should have had that in my opening remarks. The committee has finished its work, and they are summing up and preparing their report. I spoke to them just before, the chairman, just before this press briefing, and he is just about finished. He wants to have the ability to circulate it among his committee members for comments first, and then send it to me for me to present to Cabinet for their information first and foremost. So I expect that by tomorrow. It has taken a bit longer than Friday when I had first said that I wanted the report, but I prefer for them to be precise rather than just simply on time. So I do expect it tomorrow from the committee. If they do need a couple more hours or another day, I would be willing to give them. But the primary goal here is to have this done as quickly as possible, but as efficiently and effectively as possible. With respect to conditions in the lab, let me say this, that I spent many a night there with the lab technicians over the Christmas holiday, Christmas Eve, New Year's, throughout till 2-3 o'clock in the morning with them personally, because they were being asked to provide yeoman's duty, and I figured as minister, if I am asking and expecting members of my team to perform said duty, that I should be willing to be there with them in the performing of that duty. So I was there at the lab till 2-3 o'clock in the morning. The lab is in the brand new phase 2 building. No, they're not beds and couches there. It is a lab. And normally the lab technicians and lab personnel aren't expected to be working such long hours. So I think we all need to recognize that they did work those extra hours, including Christmas Day, some of them there, and Boxing Day. But I was there with them, and I can say that while it's not the most comfortable of situations there, no, but it is a professional lab. It meets all the standards of the labs, and I was there with them until they left the building on most nights. just as tired, stayed on my feet with them. I'm not a lab technician, but I wanted to be there with them, and other members of my team were there as well. Dr. George Mitchell, for instance, was there, and members from the very travel desk who were there to give whether moral support, to get food when they needed to get food or so, to run whatever errands, but to be there with them. So I'm not asking and expecting the lab technicians to continue with these long hours. Again, we will make various adjustments to prevent that, additional shifts or so, as well as with respect to travel related testing. We do need to contemplate and are contemplating the need to have private sector take up some of that burden for individuals now who will need PCR tests to go to the UK and to go to the US. That appropriate tests should be provided by the private sector and not necessarily by the general hospital or by SGU. So it's most definitely not inhumane conditions. I was there myself for the length of time that they were there. So thank you for the question.
Okay, so in relation to the question, you said if Section 17 makes provisions for Cabinet to make laws and regulations. Now, whilst you did not indicate which Section 17 of what law you were referencing, one assumes you're referring to Section 17 of the Constitution, because that is where the Governor General has powers to make a proclamation. And I think the Constitution, the provisions of the Constitution are very clear in indicating that it is the Governor General that does that, and all proclamations are indeed gazetted. In terms of any proclamation, there is no need to take a step to gazette the end of a proclamation, because they all have a specific time in which they lapse or they are to end in that process. Anything that doesn't lapse in its usual length of time, in this instance within the 21-day period, there is provision within it itself referencing that has been, anything that existed before has actually been repealed. So a review of each of the proclamations, you would be able to confirm the representations I have made, that if they have not lapsed, there is an indication that the prior declaration has been repealed itself. In terms of regulations and who deals with regulations, regulations are guided by the substantive legislation that relates to them. So for instance, in relation to the Public Health Act, regulations are signed off on by the minister, the relevant minister, as stated within the substantive act itself. So in terms of the Emergency Powers Act, that is again is signed off by the Secretary to the Cabinet as in accordance with the substantive act. So I hope that clarifies the question you have raised, and again I assume Section 17, you meant Section 17 of the Constitution.
Thank you, Callistra. Beverly, good afternoon. Beverly, good afternoon. Are you there?
Yes, I'm here, Leslie.
Okay, go ahead.
Good afternoon, colleagues, Minister and Madam AG. My first question is to the Minister. Minister, the Constitution allows for persons who have or are suspected of having contagious diseases to be isolated. So, because there is such a small number of people in Grenada, small number of active cases, why isn't the government putting those people in isolation and leave the rest of us free? Because really, why do we have a state of emergency for this small number of active cases when they can easily be isolated so that the rest of the country can enjoy some kind of normality without having to worry about a curfew or a state of emergency? Do we really need a state of emergency for that small number of people? That's the question, when they can easily be isolated and monitored.
But Bev,
and for the AG, I wish to follow up on that question which Callistra asked, because I am not very clear with the answer she gave. Section 17 of the Constitution is where she referred, and the question was, where does it give the Cabinet authority to make rules for the company? Where does it give the Cabinet authority to make laws and rules for the country? So those are my two questions for now. Thanks.
Beverly, my response to your question is because the government recognizes that the systems in place are not perfect. You yourself have said that the law allows us to place those persons identified or suspected in isolation. The law doesn't say, because the law recognizes it's not possible for you to say that only those identified and suspected are those who could possibly get it. That there isn't somebody out there still not yet identified or infected by it, simply because the government hasn't found them. And as I've said earlier, the risk increases. I do not feel comfortable, I'm not sure if you do, to be able to say that I know where the next case is going to come from. And therefore, let us all drop our guards and go out and be merry, remove the state of emergency, remove the quarantine, and allow us to exhale. I would like to exhale just like any of us as well. But at this point in time, the epidemic, not just in Grenada, but throughout the world still exists, that you will see the course of action that we are taking is very similar to the course of action that other countries are taking. I can use the example of Trinidad. Right now, I'm not sure if you're monitoring, but I am. The number of daily cases in Trinidad has significantly come down. Significantly to where they were. I think in the last week or two we would see at maximum 8 to 10 cases per day being found compared to where they were. So the same argument can be used there in terms of the question that you're posing, but the answer, I'm sure my colleague minister would give the same answer. We still need to be cautious until we are able to rid ourselves of a COVID-19 threat. We still need to take responsible steps to protect our citizens as best as possible while finding that balance between lives and livelihoods. So that is the best answer I can give you to that question. Thank you, Bev.
So in relation to the question of Section 17 of the Constitution, what I can indicate is that Section 17 of the Constitution makes provisions generally for how you declare that there is an emergency, and the provision itself provides that the Governor General may take certain steps. Likewise, the Houses of Parliament, after the Governor General has taken certain steps, may, by resolution, the Houses of Parliament may approve any declaration of emergency that the Governor General has made. So I hope I've now answered the question in full. Maybe you may need to clarify if there is anything further you'd like me to address in relation to the provisions of Section 17 itself, but Section 17 is very clear in stating that it is the Governor General and the Houses of Parliament that deals with declarations of a state of emergency.
Thank you. Bev, is that it for you? All right. MTV, good afternoon.
Okay, not quite, Leslie Ann, because the substantive question is still not answered.
Okay, which one is that?
Where does the cabinet get its authority? The cabinet is not the legislative arm of government, so where does it get its authority in a state of public emergency to make laws?
Okay, so I think you are trying to focus in relation to the regulations itself, right? As I stated previously, the regulations are guided by the substantive legislation that makes provisions for regulations to be passed. So in this instance, if we are looking at the Public Health Act, it will be the Minister of Health who has the responsibility to make regulations. In relation to the Emergency Powers Act, it is the Secretary to the Cabinet. So I hope that now clarifies or answers the very narrow question I think you're asking in relation to on what premise regulations are passed. It is governed by the substantive legislation that makes provisions for regulations to be undertaken.
And let me say, Cabinet hasn't passed any laws at all. Cabinet has implemented certain regulations within the narrow corridor that the relevant minister, in this instance myself, has the authority within the narrow corridor of the legislation, the laws. We can pass certain regulations.
MTV, good afternoon. Are you there? All right. They seem not to be there, but they were asking for an update on the Guelph Polyclinic.
Well, the Guelph Polyclinic progresses. That actually falls under now my colleague Minister Delma Thomas. So I have not been up there since before Christmas. But I know in the most recent update, the efforts to increase the services that would be offered there and to ensure that all of those said services were done in a timely manner would progress. I really cannot say whether there was any delay caused in that from the events over the month of December or not, but I can make sure and get some information from my colleague minister on it, hopefully even while we're here online if possible, and give you an update as to if there's any shift in the timelines. But what we last said with respect to the services and the expected dates of delivery are still expected to be on target.
Okay, so just to come back in relation to some of the substantive legislation, in particular the Emergency Powers Act. When you look at Section 4 of the Emergency Powers Act, it states, during a period of emergency, the Cabinet may make regulations. So that confirms what I have been indicating, that the secretaries to the Cabinet, when regulations are being made pursuant to the Emergency Powers Act, that is who the Substantive Act provides is the one who must sign off on these regulations itself. So again, the important thing to note is that when you want to confirm who is able to pass regulations, you have to check the substantive legislation to confirm who is given that power within the Substantive Act itself.
Thank you very much. Colleagues, any quick final question before we wrap things up?
Yes, Leslie, and just at the final one.
Okay, go ahead quickly.
To the AG, the Act itself is supposed to draw reference from somewhere, because an Act can say anything. You can put anything you want to put in an Act, but it has to be based in some constitutional matter. It has to come from there, and it cannot seem to be in contravention to the Constitution. So while it's there in the Act also needs to tell you where it got permission to put that in the Act, or else it can be deemed to be against the Constitution.
So to address the follow-up question you were asking, of course, Parliament/the legislature is who is responsible for dealing with legislation that is passed. There's a presumption of constitutionality in relation to any laws that is passed in Grenada. So, for instance, when the Emergency Powers Act is passed, unless a court otherwise declares, it is presumed to be in accordance, to have been done in accordance with the Constitution. The same applies for all other substantive pieces of legislation. There is that presumption of that state of affairs.
All right, colleagues, thank you so much. We have to wrap things up here right now. So, AG, I'll give you the opportunity to say a few final words, and then we'll go to the minister.
Okay, so in relation to the current regulations, I encourage everyone to familiarize yourself with the regulations so you know what are the things that you are required to do as a matter of law. Of course, you know the curfew time from 10 p.m. to 5 a.m. in terms of social activities, whether it is at your private home or funerals or weddings. The maximum is supposed to be 20. If you need to have anything above or beyond that, you do need to seek permission from the Chief Medical Officer and the Commissioner of Police for you to do the same.
Thank you very much. Honorable Minister.
Just to say that I would like to again take this opportunity to thank all of those who provided yeoman service over the holiday period to get us to where we are now. Our frontline workers, our nursing team, the team at the lab, our RGPF officers as well, Ministry of Health personnel in general, the doctors and nurses that have been providing yeoman service as well at the General Hospital and at Princess Alice and Princess Royal Hospital. We are not out of the woods as yet. They have, and us collectively as a nation, have accomplished quite a lot between the last half of December and to date in 2021 in getting back as best as possible control on our local epidemiological situation. But COVID-19 is not defeated as yet, and I do not expect this virus simply to take all the blows that we've been giving it and just walk away. It's going to keep trying to come back and come back again until we have that vaccine rollout that we can protect us all, similar to when polio kept rearing its head, when measles kept rearing its head. The solution to this virus, like any and all viruses, is a vaccine cure for it. Between now and then, we're seeing situations worldwide, including in countries that have begun that rollout of vaccine, things getting worse because of the time it takes to roll out the vaccines for themselves, and the fact that there have been new strains identified of the vaccine. You would remember in the past it was individuals who were coming from the US and UK had to go through, Grenadians themselves coming home, had to go through this extreme requirement on our part that they had to be tested before they traveled to Grenada, that they had to get a test within 3 days of travel in order to come to Grenada. And we took that extra level of caution because we recognize how fragile our nation's health and health systems are. I would be the first to say as minister, we are a developing country and we have had and continue to have a very fragile health system. So we had to take those additional precautions. But we're seeing those very same first world nations now taking the same precautions, because no matter how strong their health systems were and are in comparison to ours, they're becoming fragile now because of the extent of this virus. So regrettably, individuals going to the UK now are going to need that same 3-day test requirement, and announcements have been made by the United States as well that they need that as well to go to the United States, and announcements have been made by Canada as well that they need that to go to Canada. I don't say that to gloat at all. I say that with deep regret that the situation continues to get worse and worse in the world. But I say that to say that the science in Grenada is the science in Canada, in the US, in the UK, and in the world. And the measures that we have taken, the only variations you will find is based on, from us to any other government that is following the science, is the level of caution or the degree of caution that we take based on what the science tells us the epidemiological situation necessitates at any point in time. So it is with deep regret that we have some of our other neighboring countries going through similar situations, and we hold them in our thoughts and prayers in the same way that we assume that they have held us in their thoughts and prayers. And we look forward to all of us getting past this, getting rid of COVID-19 and putting this behind us with the rollout that we're seeing happening now elsewhere with an approved vaccination.
Thank you very much, Honorable Minister and Madam AG. Colleagues, thank you so much for joining us this afternoon. For all of you who joined us via Channel 22, the Facebook and YouTube pages, and of course those of you in the diaspora and our colleagues on Zoom, thank you so much. Here's where we end the broadcast for today. Have a blessed evening, everybody. Thank you.